So welcome to our first YouTube. This is Ali, Jade, my sister, and I'm Talia, and we are your skin sisters. And we are going to be doing some content to, showcase what we know about skin and cosmetic treatments. And before I start, I will say that all our education on here is for general advice and not medical advice. So Ali, one of the biggest things we're seeing with clients at the moment is dermatitis flare-ups. And I just wanted to touch on why perhaps maybe some clients experience this and why is it sort of happening right now at the moment with the seasons?
Yeah, so a lot of people do find that their skin is a little bit more reactive in winter, so the cooler weather. So this is definitely the time of year seasonally where people do experience that type of flare up, especially with skins like dermatitis or eczema. So those type of conditions do experience. Winter months are definitely the worst.
In terms of symptoms, what would you say that you would see a client come in with generally?
Usually we see like red and inflamed, maybe even a little bit scaly skin, very dry, lacking a little bit of water as well. So skin's just definitely very stressed.
And the chances are they've put something on their skin to try and help, right? So we're sort of seeing it when it's more inflamed, more red, more irritated. So I think at this point when they've come into the clinical setting to see us for treatment, they've come to you because the creams maybe aren't working or their skin barrier is impaired. So what would you suggest that they start with, even just from a home care perspective?
I would definitely say to put the steroids down. I would definitely say that that has a long-term bad effect on the skin. So we're looking at more of a anti-inflammatory topical approach. Things like vitamin B or hyaluronic acid is a great natural anti-inflammatory. It will give the skin a lot of relief.
So if you were to give anyone any advice as to what can potentially trigger their dermatitis, what perhaps advice would you give to these people?
Yeah, so we're looking at actually the internal. So we're looking at how the skin is responding with what's being disrupted internally. Anything that is heat inducing, like heaters in the car directly on your skin, saunas, medication.
Spicy food sometimes too, right?
Yeah, definitely spicy food. I would also say like caffeine intake is also a big one, and you find that that is also a big trigger. Lots of dehydration comes from excessive caffeine intake.
Sometimes I also find clients have come in that have been using really harsh cleansers.
Yeah.
Why does that seem to flare up dermatitis? Like what's in it that's actually causing these flare-ups?
It's quite confusing. A lot of people do experience a lot of dryness, so they think that they need to be exfoliating. There's like a happy medium for your skin, like not over exfoliating, looking at those actives, safe actives. So things like lactic acid is a safe exfoliant or enzymes, whereas glycolic or salicylic would be interrupting the barrier function.
And they're so commonly found in our cleansers. Like I think most active cleansers have at least one of those active ingredients, right?
Definitely a lot of hype around AHAs, but it is specifically for the right skin type. But eczema or inflammatory skin conditions, you have to be very careful with actives.
You know, it's fine for us to say that we can prevent these flare-ups, but for a lot of the time, the way that we live, our environments, it does mean that we can experience these flare-ups. Things that are they're not within our control, which means that, they can come into our clinic and see us and have these conditions looked after by you. What treatments would you recommend for clients that are experiencing dermatitis? Are there any treatments?
I would definitely be focusing on a hydration approach only, where you're going to get that anti-inflammatory approach as well. So I'd be looking at like gentle resurfacing. You can look at doing some lactic peels. These are not going to disrupt the skin, especially when it's going through a flare-up. Looking at layering safe actives like your water-binding ingredients to be able to really feed the skin nutrients, but also help with hydration.
When we look at internal factors that can be flaring up skin conditions, in particular dermatitis, what I found was there was actually quite a significant link to a histamine response in the body and the inflammation of the skin with many different skin conditions. In our research, we found that avoiding foods that are considered to be high in histamine can actually help with flare-ups or preventing flare-ups of dermatitis, those internal things can also impact rosacea as well. So if you are experiencing any particular skin concern, look at what you're doing internally rather than just opting for topical skin product. One of our patients, I thought she had scarring from her dermatitis flare-up, but I think it's just taken her so long to heal. Now, since you've changed one of her products and gave her something to help assist with the inflammation, it's significantly gone down over 4 weeks, but she still has that post-inflam look to her skin. You can sort of see the markings of where the dermatitis is.
Yeah.
What would you do for someone like that who's maybe got the right routine at home, who's coming out of their dermatitis flare up and they're wanting to further improve their skin?
You're definitely looking at LED light therapy as an ongoing treatment that can assist with that inflammatory and still that skin presentation that's still lingering from the effects of a flare-up. But I would be consistent with your anti-inflammatory topicals. And yeah, unfortunately, like over time, this sort of thing can just eat away at the skin and cause that bit of disruption. So no soap.
No soap on the area.
Yes, definitely no soap. And also, I think no one really talks much about perfumes and fragrance and essential oils because that definitely has a negative impact on these types of conditions.
When it comes to active ingredients, what are the key active ingredients that you would be looking for someone suffering with dermatitis? You mentioned inflammatory products, but what would you say is the most active ingredients in inflammatory products?
So vitamin B would be my absolute go-to, particularly because you're seeing an improvement with the hydration levels, but that really red, raw, inflamed skin that needs quick relief, but it's potent enough that it's actually going to penetrate and make a difference.
You've just highlighted the importance of understanding the science behind ingredients rather than glorified marketing, because marketing a product, I want to know, why does this product help your skin? What's in there, specifically the science behind why this is helping acne. I think people are so quick to buy something off the shelf and put it on their skin. But we understand that even as far as reading food labels now is so important. Know what's in your food. Know what you're eating and consuming. It's the same thing with our skin. Know what is actually in your skincare products. Now, you don't have to go and remember every single ingredient, but you do have to know, what are these active ingredients and what are they doing for my skin?
While some products that you can just excessively get at a drugstore smell really nice and they feel quite nice on the skin. They do smell
nice and they look pretty in their packaging, and they might have, fancy ways to use them. And
definitely when they say anti-aging on there or they say collagen stimulating, all those types of things, they will definitely get you. But you look at the quality, and I think when you look at cosmeceuticals, you're looking at the quality. You're looking at maybe a tailored approach where a professional is able to identify concerns you have with your skin and the ingredients you need to prioritize to be able to actually address your concerns, as opposed to something smelling nice or feeling good or that you think it's going to help with your pigmentation. Knowing that a professional is able to assess your skin correctly and be able to tailor the appropriate actives is where the corrections will be made.
We're excited to take you on this journey of us learning more about how we can look after your skin in our clinic, how you can look after your skin at home, and just cutting the BS with a lot of what we see as well. It's time that we stood up and really put some of these trends aside and started to advise people that, there's other options out there that are actually going to work, but you are not a one size fits all. I always tell my cosmetic patients that one size fits all is not our approach, because everyone would look the same, right? So in everything we do, it's about customization and planning to suit your current condition, your current skin, and what you need and what actually plan you want to follow.